So with this, this is an intervention to improve hand behind the back. So let's say during your assessment you notice your patient is limited with not just reaching behind the back, but also too you notice the medial border of the scapula is really popping out into internal rotation. So this is a way that you can try to mobilize, so the glenohumeral joint will be stabilized here, and mobilize the scapula on the humerus. So your patient, and this is an option, in a little bit we'll be showing it in sitting also too, but what you can do is if prone is a way that you want to mobilize, have your patient here. We'll place their hand behind their back. Ooh, or how are you doing?
I'm fine.
Yes, okay. So my left hand is just going to stabilize along his hand and distal forearm here. And then hopefully you can see this is the medial border of his scapula. So as I have him stabilized here, with my right hand, I'm going to be pushing in a posterior and medial direction, posterior medial direction. And if you look at the orientation of my forearm. So because we're mobilizing the scapula basically on the thorax, it might be a little bit harder to do like a true R1, R2 because it's a pseudo joint, but still you can assess for that first resistance R1, R2, R1, R2, and then mobilize accordingly. As you feel like maybe things, or you see the reduction maybe in the internal rotation, or you want to wind up the intervention, then you can slowly increase the amount of internal rotation that the arm is positioned in. How are you feeling here?
Okay.
Doing okay. So as I increase the hand behind the back range, we see the medial border pops out again a little bit more. I'm going to push in a anterior medial direction. Mobilizing the medial border and relatively the inferior ankle as well.